discuss the recent adoption of the UN resolution to addressing the challenges affecting persons living with rare diseases and their families, and what this means for us in Kenya. And also, we will get to understand the role and the value of research on rare diseases in the country and the strides made therein. We will also delve into patient rights and how individual advocacy can help people living with rare diseases. Let me mention at this point that the international theme for this year's Rare Disease Day is Share Your Colors, and we shall understand further the reason for this theme and how we have done or what we've done to illuminate the same in this country. Now, let's get the ball rolling rather. And here are some facts and figures about the rare diseases. If you're hearing about rare diseases for the first time, it is imperative that you understand that the first Rare Disease Day was held on February 29, 2008, globally. Now, the inaugural Rare Disease Day in Kenya was held in February of 2014, so it is 8 years old today. There are 7,000 rare diseases in the world. So in case you're wondering if they're rare, what we're talking about, where there are many. Now, over 300 million people, as I mentioned earlier, globally are living with rare diseases. Rare diseases affect more people, more than cancer and HIV and AIDS combined. Think on that. It takes about 5 years to diagnose a rare disease, and 72% of rare diseases are genetic in nature. 70% of the rare diseases affect children, unfortunately. 30% of children with rare diseases will not live to see their fifth birthday. Now, only 30% of rare diseases have treatment, and the list goes on and on about the facts around rare diseases, and we'll be touching on this as we go along. Now, these are facts that clearly contribute to the patient's treatment outcomes and, by extension, their quality of life and those of their caregivers. Ladies and gentlemen, as I mentioned, this is the focus of our conversation today, and I will mention that I became a friend of Rare Diseases Disorders or Rare Disorders Kenya in 2018, and since then I have met amazing people. They have told their stories, and you can't understand the struggle of living this reality on a daily. So thank you for making time for this Rare Disease Day, and we are marking this day here at the Baraza Lab, and of course we are being hosted by the Rare Disorders Kenya fraternity. Now, some of the people that I've met along the way in my line of duty, and I'm sure some of them are joining us today, let me just say a big hello to Alice Wangoi, who lives with myasthenia gravis, Ruth Wamboi, spinal muscular atrophy, caregiver to baby Naila, who is 2 years old. Ruth Wamboi is one lady who is very vocal about advocacy, and we'll be talking about the importance of advocacy when it comes to rare diseases. Patricia Karani is another very loud advocate of the same, and she will be joining us even as we have these conversations this morning. Alice and Georgia Likimani, also caregivers to a son with Duchenne muscular dystrophy, DMD, and these are caregivers that know exactly how that shoe pinches when it comes to the reality of rare diseases. Now, this is just a testament that just because they are classified as rare diseases, there are people living this reality amongst us. And due to the awareness creation that has been going on here in Kenya, thanks to the Rare Disorders Kenya fraternity, a lot more people know of them, and a lot more is being done to support those living this reality. And speaking of which, time to get to know the faces behind the Rare Disorders Kenya, who are hosting us for this year's Rare Disease Day. And as you can see on set, I have Rosalyn Kanja, who is a co-founder of Rare Disorders Kenya, and Christine Mutena, also a co-founder of Rare Disorders Kenya. Ladies, thank you, and thank you for having us. All right, and happy Rare Disorders Day.
Same to you.
All right, so even as we say, and I've mentioned this, that Rare Disorders Kenya is a patient-led organization comprising of patients, parents, and caregivers of persons living with rare diseases in this country. What exactly is your mandate, Rosalie?
We are a patient-led organization
Yes.
that looks at creating awareness about rare diseases in Kenya, and also just giving support to the community and pushing for policies and change towards the rare disease fraternity.
Okay, all right. And Christine, you are a parent to two daughters,
Yes.
each with separate rare diseases.
Yes.
Talk a little bit about your experience.
It's been hard, I won't lie, because For the firstborn, it was unexpected, as with all rare diseases, but then we made sure we checked for the secondborn to make sure she didn't have what the firstborn has, because you assume rare diseases are genetic, hence the same. But shock on us, we got something totally different, because the firstborn has it's a mouthful, megalencephaly capillary malformation. My second one has ring 18 chromosome. So those are two totally different conditions that manifest separately. Rosin will just tell you, like, today, before we came here, we were to make sure the kids are fine, everything is sorted, then you can leave the house.
Okay.
Yeah.
And speaking about the challenges, tell me, in your walk with your children, what are these gaps that you found in the system clearly when it comes to the RD space?
So there's always the unknown. Some diseases don't have enough research on them. Like at the time that we got the diagnosis for my son, there were only 600 known cases, like documented. In the country at the time, I was the only one who was known. Like every time we would go to a doctor, either they've not heard about it, or the one that they knew about, unfortunately, had passed on. So there was always that unknown. So you're the one constantly telling, like, I would ensure that every day, like, I'm checking the research, what's going on. So when I talk to a doctor, I know this is what we need to do. But not everyone has that luxury or the capability of doing that. So that is that you find that health professionals are not quite equipped. It's not their fault. You can't know all 6,000 diseases. And then, that the fact that it's genetic, there's a possibility that it might occur again. And for other families, you have children who have more, the same disease, either manifesting in another way. So of course, people will start looking at it like, your caste, something has happened to you, you did something or didn't do something, you're being punished. So that adds to the pressure that you really have to deal with.
And speaking about the pressure, Christine, 2 kids back to back, you tried what you could, even with the second one. How did that pan out, especially when it comes to the stigma?
Yes, I was actually going to say stigma. Stigma is big in the sense, I'm lucky because the people around me understood. So they actually encouraged us, like, this is fine, it doesn't matter, we'll raise the kids as a global, like the village, like how it's supposed to be. But not everyone is lucky, because as Rosie was saying, people will start saying, oh, you're caste, and then since they're genetic, you probably find if you're not a carrier, your kids are affected. So you'll have like 2-3 children with the same condition, and it's in the village, and no one wants to even come near you. No one even wants to talk to you because they say, leave them alone, they'll infect us, just basics. And sadly, stigma is huge. But for me, on the other side, what I did for my context is I made sure I am accepted, which was very hard, but accept that your children have these conditions. There's nothing you can do about it. Then now start enlightening the people around you, the circle around you. Go small, start as a family. As they say, charity begins at home. Start as a family, then go outside the circle. Slowly you'll find that the society around you will accept your children as they are because of how you treat your own kids.
And thinking about looking at the glass being half full, I mean, advocating for your children to ensure that people understand them better. You touched on the fact that the in and out of a hospital is immense. Talk about that experience and the hardship that comes with.
So the issue is that sometimes you have to constantly see doctors. I always keep saying that initially we had to see like 7 doctors. You have neurologist, you have gastroenterologist, you have, at some point he needed surgery for ENT, and constantly moving from one doctor to the next. And sometimes a doctor would prescribe one thing and it affects the other. So you have to do the coordination. And that is one of the things that we really encourage or ask doctors, that you can have like a multidisciplinary approach. Like the doctors need to talk to each other so that I don't do the running around of, seeing this one and that. So that was quite intense. And you see, it's every day. The first 6 months, we were in hospital every week, at least 2 times, for one thing or the other, going back and forth. So that it was a lot. That means, of course, you can't do anything else. And you're also at home like the nurse. You have to be able to deal with things immediately. My son to this day, even just water chokes him up. So you have to be constantly alert. Small things can, put you already, emergency situation.
Okay, and it doesn't stop at that age, Christine. I see your post saying, we have a doctor's clinic, we have a doctor's visitation. Talk about that and how perhaps it gets better with age.
it stabilizes. It doesn't really get better, but it kind of stabilizes, or we get used to it and we become the experts in that scenario. But I think once you have like a constant doctor who knows and gets to understand what condition your child needs and how the management is going to be done, you find that now you're both on the table, you're both discussing, because we tend to know more because we research about that one particular condition, like for Rosalie, but in my case, like now I have 2 daughters. But now we come and tell the doctor, look, this is what they have, this is the protocol that we need to follow. Once you're on the same table and we're discussing that, you find that even management for those cases, different cases, are easier. Even like when you get home and you know something is wrong, it's easy to call the doctor and they'll pick up. Nowadays, our doctors are good. They pick up and they say, you know what, I think my daughter has this and this. Either they'll give you something to do at home or give you a protocol such if it escalates, you go to hospital, such things. So it gets easier, but I think we also get better. We have to give ourselves credit, Rosalind. We get better as well.
And I'm sure you're talking on behalf of many caregivers that are catering for patients living with rare diseases. Now, Rosalie, it gets better with time and perhaps doctors are more conversant with what they're dealing with. But what are these other strides perhaps you've seen over the years that you can see are achievements within the rare disease space?
So currently we are seeing that we've been working with the government at the Ministry of Health. So we're seeing more and more, participation. Now your partners, they are willing to have this conversation with us. They are willing to work with us. This is a big jump.
Yeah.
In the other sense, we are right now starting to scratch at the thought of doing research on rare diseases, something that will be talked about later on, and you get to hear about that. Our community is growing. More and more people are coming out and saying, yes, I have this. And as they come out, it means that we have a place where they can, it's like their own tribe, you can be able to talk about these things and people understand. So that is happening, and diagnosis is getting sort of a bit easier, especially because when they come to us, sometimes when they don't know which doctor to see, we say, oh, maybe you need to see a neurologist. And from then on, they go down the path where maybe they get a diagnosis, or maybe they're able to have better management. And then the awareness is growing. Every year we are, Rare Disease Day for us started in 2014, and every year it's growing. So these are some of the milestones we are sort of celebrating. There's a lot to be done, but we've taken the first step.
Yeah, Christine, great strides, of course. Tell me, when you think about the first time you had these little babies that you needed to take care of, you felt like you're the only person who's got to deal with this. But as the village, I'll call it a village, grew, how or what does that mean to you as a parent?
I can't sleep at night. In terms of, I'm not as worried as I used to be. And it makes it even better for me knowing that other people are getting help even more. So there's this saying that says, like, if you can sleep at the end of the day knowing that you've made somebody else's life a bit better, then you're good. You've had a good day. So for me, that is what keeps us going. So it's basic. Just even if it's one person a day, one person a week, that's more than enough.
And you have 2 of these children to cater for. How are you coping many years on?
I've noticed something. The firstborn is actually taking care of the secondborn in terms of like, Mommy, she's called Kayla. Mommy, Kayla needs this. Mommy, Kayla needs, can I do this for her? And so I'm like, oh, wait, somebody's actually getting old and responsible, So that's the small things that are minute are huge. So for me, that helps a lot in terms of, and then also hospital visits have spread far apart. So it's not so bad as it used to be. And then you see as they grow older, they get stronger, you see them trying to do things the doctors told you they would never be able to do. And that gives you, I don't know if it's more than hope. It gives you a reason to actually believe in the future.
Okay, and that in itself gives a lot of hope to other caregivers who perhaps are joining us today, or those who are joining us today will tell other caregivers who are living this reality the importance of being part and parcel of their rare disorders. Kenya, tell me this. How can somebody be part and parcel of this village we talk about? And what's the value of the same, Rosie?
So, one, reach out. They will have contacts even after that. So if you are living with a rare disease, you've never heard of us, please reach out. you'll find a community, and sometimes you'll even find someone else living with that disease. They'll be able to give you their hacks. Sometimes you find that people who have younger children, they're looking for those who have older children, so that you know what it looks like, sort of like the prognosis, rather what does it look like ahead.
How has this network come in handy, especially living in a pandemic world, Christine?
We've gone international and regional, and that has also helped us as an organization in terms of reminding us what you're doing has a meaning. Because if you look at it from the day-to-day aspect, you can't see the growth. But if you look at it like from a top looking down, you're like, wait, you've done all that, So the pandemic has helped more because now there's virtual, we can interact, but also it has helped us realize that we have gone more across the borders.
And to add to that, the pandemic, in one way, what has helped is the fact that now we have what is telehealth.
Yes.
Before someone from Malindi, where I come from, and you need to see a doctor, and assuming it's not something that you really need to come in through, you can be able to call in and see a doctor, vis-a-vis coming all the way to Nairobi. So that has helped in a way. And maybe you just need a prescription refill, or just something small that you need to discuss with your doctor that you don't necessarily need to come home.
The cost of living this reality is exponential. I mean, just going by the look on your faces, this is something that you know how that shoe pinches. What more can be done to help along? I know you make great strides, but what more can be done?
Insurance. Our conditions are genetic, they are pre-existing, they are congenital. So you find that insurance we lack out on that space. Also in terms of special needs in the country, we are a bit lagging behind. So if we're with education, we also struggle to educate our kids because they might have intellectual disability or even physical disability and delayed milestones, but they're still kids who need to grow. We need to tap onto that mental, what do you call it? I don't want to use the word education, but just to let them grow intellectually as well. So there's also education. Then there's a social aspect in terms of society, because I think it's all aspects are just costly, not only financially. That's a sad part. Yeah.
Allow me to add to that the fact that also we need research.
Yeah.
As a country, we do not have a definition of what a rare condition is. Currently in Africa, we do not have that definition. Why do we need the definition? Then we can say this is what rare diseases are. And beyond that, we can be able to make policies and plans for the rare diseases in the country. Then we can be able to have even data. The other thing even is, as a country, we need to start thinking about newborn screening. When a child is born, you're screened for certain diseases. For example, a disease like sickle cell, at the very least, in this part of the region, this is a disease that is, a reality, as opposed to a country like maybe Austria. You won't find it as much. So those are some of the things that kind of need to be like a now. They need to be worked on now, so that we can be able to, have a huge impact for the rare disease community. We might not be able to eliminate the diseases as such, but something can be done to make it better and easier. And also diagnosis has to be faster. Doctors have to change mentality of common things are rare. So we always say on the rare disease community that don't exclude a rare disease until you have conclusively said it's not, as in tested for it. But not remove it fast and then think about others and then later on bring it in. Of course, there are a lot of common diseases, but then for that rare patient, 8 years means maybe a loss of life.
Yeah.
By the time you realize, maybe it's the second, third generation, then you're like, oops,
Yeah.
Okay, and we'll be hearing of some of these realities just in a moment in a video of others that are wearing these shoes in a moment. And even as we bring this session to a close, ladies, in December of 2021, the UN General Assembly formally adopted a resolution recognizing that over 300 million persons living with a rare disease worldwide and their families. Christine, what does that mean for you?
For me, I'm excited because it means that Kenya, which is part of the UN, will, for us as rare diseases, RTK can talk to the Ministry of Health and tell them, look, this is what has been passed. How can you get to where other countries are? Kind of like gives us a pedestal to actually move rare diseases to another level. So for me, that is big. That's even why I clapped.
Yay! Okay, Rosaline.
For me, it gives us that legitimacy. I guess it's what she's also saying. Like right now, when we go to either it's at the government level or any other institutions, that you find that if it has been addressed at the UN level, something needs to be done. And it's actually, now we can start putting together either budgets for it and among other things. We are starting to recognize that. And I must say at this point that our government is doing a hell of a lot to address this, and I'm sure she will talk about this when she comes on board,
Yes.
which we are happy about.
Yeah.
So yes, the UN resolution was a big thing for the rare disease community. Yes.
Clearly, there's a light at the end of this tunnel, and that's why we've got to always celebrate the Rare Diseases Day to show these milestones that have been made over time. And we'll be delving into some of the issues that have been brought up by the ladies in a moment in other sessions. But hey, thank you, Christine Mutena, Rosalind Kanja, both co-founders of Rare Disorders Kenya. And at this point, let's play a video that perhaps also contextualizes further the reality we're talking about, living with a rare disease and also just being a caregiver.
My diagnosis took a long time, close to a year, because I was in and out of school and visiting doctors. Many doctors didn't know of the condition, so they gave me very many different wrong diagnoses, even medication. So it reached a point my mom came across narcolepsy on the internet. She read about it and she could link so many of the symptoms to what she was reading and what she was seeing. So she suggested it to a doctor. The first doctor thought that I had made it up in my mind. Yeah, he thought I was imagining the condition. So with time, we got a doctor who listened to us and did a few tests that gave us the clear revelation that I had a rare condition.
The challenges we went through, it was too much. He's our firstborn. We were not aware there is such condition that can occur, and we are totally blind what to go about it. To get the diagnosis, it took 3 to 5 months. He had a challenge of getting pneumonia attacks on and off. And now that weakness of the muscles, he can't stand, he cannot crawl. So then we started to seek for medical attention. We did some tests for calcium levels, what level. Now he said we need to see an orthopedic. An orthopedic decided to do a test called muscle dystrophy, and it came out he has a muscle dystrophy. Then he was sent to a neuropediatrician. He decided he can do DNA to determine whether it's genetic or not. The test was done in South Africa. It came out after 1 month. It confirmed that it is muscle dystrophy, muscle spinal muscular atrophy with nerve disorder. We thought it's something we'll be given a medication and he'll get well. We were told nothing he can be given as a medicine, so we advised now we do physio for home-based. We look forward, was coming in the house up to date. But the condition, it doesn't get good, maintained, but it deteriorates day by day.
I was diagnosed at birth because shows through a webbed neck, and so I was born with a webbed neck, so the doctors could suspect something was wrong, and that was the only condition they could put their fingers at. I was born with a hole in the heart, which by that time required an operation, but we had to depend on doctors that could come from abroad, and also to confirm the condition, the Turner syndrome condition, they had to send the tests abroad, because in Kenya there are no equipment to test for that. So they had to invest in sending the tests to be done abroad. Yeah, so it was really expensive, because I had to come for clinics and checkups, yeah, with the doctors.
It took long to get the diagnosis because the doctors were not aware what was happening with Stacy. We were told that she had cerebral palsy and that we had to put her on a CP chair. We were sent for MRI and her scans. So the scans showed that one part of her brain was bright, the other side was dull. So which actually, as the doctor said, meant that she had an issue in her brain. She actually told me they don't know what is going on with Stacy, and if we keep on looking for more answers, we may never get it. Yeah, so what she would do for me is just to manage Stacy, and then we hope for the best.